Hello everyone, it's Audrey Cole again. We are here today again to talk about everything Medicare related. I'm from the Western Connecticut Area Agency on Aging, and I'm here today with my colleague Gene Brandon. He is a volunteer for both the SHIP, which is also known as the State Health Insurance Program. They navigate Medicare, and my program deals with fraud, errors, and abuse in Medicare. So I met Gene a couple years ago. I go around the 41 towns. I really have 52 towns. I go up into north central Connecticut too. And I give talks about Medicare and the Senior Medicare Patrol program, how to avoid becoming a victim of fraud. And I deal with a lot of issues relating to billing disputes, billing errors. Anyway, I was down in Ridgefield. I was giving a talk, and I had a colleague there also. She was talking about the SHIP program. And Gene, you heard us. What did you know about the Western Connecticut Area Agency on Aging before then?
I knew absolutely nothing about the Western Connecticut Area Agency on Aging. It was eye-opening in terms of realizing that there was an organization that was specifically there and commissioned to help people understand and navigate Medicare, and also address things like errors and abuse associated with Medicare and Medicaid programs.
Yeah, and a lot of people don't realize that the Western Connecticut Area Agency on Aging is a not-for-profit. So what happens is the federal government sends grant monies to the state of Connecticut, which in turn distributes it amongst the 5 area agencies on aging. We're one of 5. And as I said, we go from basically Salisbury, Connecticut, over to Barkhamsted, down to Cheshire, and in Western Connecticut, Ridgefield. So after that presentation that I gave, what motivated you to call us and think, hey, I might want to be a volunteer?
Sure. So I was very interested in the topic for several reasons. One, I have an elderly mother that we were actually helping her continue with her Medicare plans over a number of years without really understanding that much about it and just using the online resources that were available. We basically just continued her normal stuff with that. Then both my wife and I were turning 65 about a year later. So I said, I really need to understand this a lot better to make more educated decisions for us as well as for my mom and her situation as she was aging. So I think it was a great opportunity to learn more for ourselves, but also to potentially volunteer. So I saw a brochure in one of the handouts that you left for us that basically said there was a volunteer opportunity for individuals like myself who were retired for a few years, who were had a lot of fun things going on already, but still wanted to give back to the community. So I had already done some things in emergency response locally and helping in disaster situations, but also had extra time. So instead of just going to the senior center or going golfing or going out to games all the time, I felt that finding something that I could use my brain and my prior experience working at a large company for almost 40 years, I said, why let that go to waste in terms of the ability to navigate complex issues? And Medicare is not that easy to understand for somebody that's been getting health care coverage for their entire careers. And the company took care of helping make decisions for us before, and now we had to make our own decisions. So it was a lot more complex to actually go through and understand the complex web of what Congress had passed in terms of legislation over many years that became the Medicare program.
And you have an employee retirement plan, right?
I do.
Yeah.
I do.
And so when we're out in the field and we're talking to people, that's one of the issues, that everybody interacts with Medicare differently. My parents had great insurance, and I thought I knew a lot about Medicare, but it's really kind of like a silo that depending on what your relationship is going to be and what choices you have to make, whether you're going to have retiree insurance from a former employer or you're going to be on your own, or for example, you're going to maybe get some assistance. There are many assistance programs out there. It's all different.
Right.
And I tell people the 2 most important issues that help you decide what plan is best for you is going to be your finances and your overall health. So that is very different from, as I said before, your neighbor may have a great plan, but they don't know your finances,
Right.
and they probably don't know the details of your health. And vice versa.
Sure.
They aren't going to confide in you all their finances and health. So what were the steps you took then when you thought, hey, this might be interesting?
So I actually, there was a reach number on the flyer, similar to one we have here, and and basically said, okay, I'm going to call the number, find out a little bit more about this program, and then determine whether or not it's something that might be worthwhile to spend some time, and figure out if they could use the amount of time I was willing to provide. I wasn't willing to go back and work full time.
And that's very
right,
important,
right?
Right? And also you have a commute to get to
I
the
do.
office.
So it's about 45 minutes for me to commute to Waterbury from Ridgefield. It's and on weekends it can be longer on Friday afternoons going home. So
but you can also work remotely on a couple
we
of
can.
things too.
Sure. Many times I do work remotely, following up on a specific case situation and trying to get the information I need to be able to respond appropriately to a beneficiary. There's also, during the open enrollment period in the fall, I tend to work a lot more in terms of one-on-one sessions with people at specific senior centers across Western Connecticut.
So what were the steps that you had to take to be trained?
So training was interesting. First I went through sort of like an interview with one of your friends who's actually been on the show before, Amanda.
Oh yeah.
and she told me a lot about the program, and she asked what I was looking for in terms of what kind of skills I wanted to bring to the table, what was I looking to get out of the program. So I spent about an hour with her, and my wife, by the way, talking about whether this was the right type of volunteer opportunity for me. So I made a decision after that call that I was interested, and I was willing to go through a one-day overview session of what the training would be like. And so with that, I was able to find out enough about the program to say, yeah, I think this is something I'm willing to commit to. And I had said I'm willing to give a day a week during most of the year, and then during open enrollment, I'll work most days.
And tell everybody what open enrollment is.
Open enrollment is the time of year where those that are on Medicare have to choose whether they're going to continue with their current plan or shift to a different plan, whether it's an Advantage plan or traditional Medicare with the
They
Part B
should.
prescription drug.
Technically, they don't have to.
Correct.
But if they don't, they could be stuck with a plan that doesn't meet their needs.
Right. People's health needs change, their prescriptions change, whether they, maybe they started falling and going to the hospital and they've never done that before.
And like, for example, this year, many of the insurance plans that were on Medicare.gov, they dropped being a PPO, preferred provider organization, and they switched to HMOs, a health maintenance organization. So sometimes you don't even have a choice. So if you ignore it, you could be put in a plan without even knowing or be dropped. And come January, you might be really confused.
Sure, and you'll get a letter. And one person that I'm friends with, she got a letter saying her employer was terminating retiree health coverage. So that she didn't even have that option anymore. So she had to start from scratch, and she was over 80 years old.
Wow.
So that was an unfortunate situation where I could help her navigate what the best options were between original Medicare and Medicare Advantage. And
I should clarify, so Senior Medicare Patrol, my volunteers, and by the way, both our programs, the State Health Insurance Program and the Senior Medicare Patrol Program, wouldn't really function as well as they do without our volunteers. They really are the bedrock. The government can't really afford to train all these people in detail. So this is a way for people to be useful, to do volunteer work, really learn a lot about Medicare. But the Senior Medicare Patrol Program, my training is a bit different. It's all online, it's self-paced, and the time commitment is really not as strict as choices. Choices ship, ideally, from what I understand, they would like a volunteer in every town in the 41 towns.
So yeah, and I didn't quite finish as far as the training itself, right? So with the SHIP or Choices program, It's about 6 weeks of training, not every day, but it's like a couple days a week. And you go through, half days and a couple of full days to actually go through what is Medicare Part A, what is Medicare Part B, what is prescription drug plan, what's Advantage plan, and then all the other things that occur around those programs. And so the training is very thorough. Center for Medicare Advocacy comes in, as well as the supervisors for each of the area agencies of aging for Connecticut and the director for the state. And they do a phenomenal job of really getting underneath everything we really need to know to start talking to people about the Medicare program and what is appropriate for them. And they have case studies. They have a whole variety of techniques that they use with us. And then we go through testing. We go through certification. I mean, there's a decent process to get through before you're actually
And then
going
we have
through that.
refresher training
We have
and so
refresher,
forth.
for sure.
It can be very intense, and it's a kind of a blend. Some of it is in person, which is a great opportunity to meet fellow volunteers, and some of it is online now,
Right.
as I understand. My program's all online, but yours can
Sure.
be.
And I was still, right after COVID, almost everything was remote to start.
Right.
So we went through all remote training, and it worked out fine. I think in-person, the combination of in-person actually helps a lot in terms of getting to know some of the people in the network that might help you in terms of the types of things that you might encounter. Also to call on if you have questions, because you will have questions.
We have a great little
Yes.
group of people who kind of brainstorm a case or a problem when we get together, which is wonderful. There's a lot of camaraderie in terms of sharing that knowledge. I do tell people that training can sometimes be a bit overwhelming, but the most important thing you have to remember is, and I tell people this, I think it's very important, you learn by doing. You can memorize all that stuff and do all that training, but it's so much, and Medicare is so complex and so complicated that it isn't until you come in and you start taking the phone calls, speaking to people, having a case, maybe you put someone on hold, or if you don't know the answer, you get back to them and contact one of us to assist you in answering the question.
That's
But
right.
you become pretty much of a pro on that, though.
Yeah, I mean, we're in the same office, right? So in Waterbury. So it's easy for us to actually just have a quick conversation about a case, right? And obviously we do it in privacy so that not everybody understands what's going on in the situation. We try to make sure that we maintain the security of everybody's information. So I think that's very important to ensure there's trust and confidence in the program, across the country. I mean, this program is across the country in the various
Yes.
agencies
Yep.
of aging across the various states. So it's I think it's really important that we maintain that network. And each state is a little bit different because the rules are different in each state. The implementation of how the Medicare program operates in each state is slightly different from other states. So you might not be able to get a Medigap policy or a supplement policy in some states unless it's a specific time of the year or a specific time in their experience. But with Connecticut, it's a lot more open. So guaranteed issue rights if you have original Medicare to get a supplement plan or to change supplement plan. So it's something unique, and Connecticut has a phenomenal program for that.
Well, I tell people, if you call Medicare, and I had a woman just a week ago, this is very common, where she'll say, oh, I called Medicare, I don't qualify for that program. And so one of the programs is the Medicare Savings Program here. It's a fabulous program. Connecticut is one of the top 5 states in the country, very generous. It doesn't look at your assets. And I told her, if you call Medicare down in Washington, they don't know Connecticut's rules and regulations on that case.
Right.
So that's why if you have any questions about Medicare, you call our agency. We should be your first door. We're unbiased, we don't get commissions, and I'm just going to read off our 2 numbers quickly, 1-800-994-9422, toll free, or directly 203-757-5449. So, and when is the next training coming up?
So it's actually coming up starting in mid to late July. But there's training a couple times a year for the Choices program, and you could actually
spring.
you could actually start volunteering even earlier, and in between cycles, and then you gradually can get back into the training. So it's important to figure out that you want to do it first, right? So you have to have those conversations that take a little bit of time. But there is an information session that there'll be shortly. If you call the number 203-757-5449, we can actually put you in touch with the person that's running the program.
And if you can't make one of the training this fall, they can keep your name and call you when the next one is up
Sure.
or available.
Just one thing on that, though. The Medicare Savings Program, she mentioned, there is a 2-page brochure, and we usually fold it up, but I didn't for this purpose. But it basically tells you the income levels that you would have to have as a single person or as a couple to determine whether or not you qualify for the Medicare Savings Program. It's great because the Medicare Savings Program, you can get your Part B premium paid for by the state of Connecticut if you qualify for any level of the Medicare Savings Program. And so that's, I think, an important benefit. Plus you get reduced costs for your prescription drug plan, whether you have original Medicare or the Medicare Savings Program.
And don't assume that you don't
Medicare
qualify.
Advantage.
You really have to call one of our counselors,
Right.
like Gene, because we go through many of the criteria. For example, you could have a part-time job. It's not in that brochure,
Right.
but they look at less than 50% of your working income.
Mm-hmm.
There's earned income and working income. They're separate. You have to understand it. That's why we're here, to explain all that detailed stuff. Another thing I want to tell everybody about, the Medicare and You book, all right? We have an example of one here. You should get this every September before open enrollment, because the government wants you to know, okay, open enrollment's coming up, know your choices. This book is very important. If you go to the online PDF thing, that's a national booklet. The nice thing about this booklet, in the back of it, it actually lists the plans being offered in Connecticut. So you can get a brief summary without going on to Medicare.gov. That's why don't throw this book out right away. Very important during open enrollment. We kind of use it. Mm-hmm. Some people refer to it as the Bible. I don't, because when I work on the difficult cases, it just gives a brief overview of how Medicare works.
Sure.
But as I said, it's really complicated.
Yeah. I mean, as you could tell, but it's a 122 or so page book, right? So not everybody really wants to go through all that level of detail, but you do have to at least understand what's changed. And they do have some summaries of what's changed in the book, so that's helpful.
And one of the most important things, so when people call me about a case, they're disputing a bill, and I say, well, what's your insurance? And they're like, well, I don't know, I'm on Medicare. Mm-hmm. And then I find out they aren't on Medicare. They have the Medicare red, white, and blue card. But they opted out for private insurance, which is known as a Medicare Advantage plan. It's kind of a more holistic plan. Mm-hmm. It usually includes dental, hearing, and vision that Medicare doesn't pay. And I saw you brought one of the supplements.
Sure.
People on original Medicare.
Yeah, so people on original Medicare, 20% of the costs are actually paid for by you. You're responsible for them. The way you get past that, where you don't have to pay your hospital cost 20% and your provider payments 20%, is by using a Medicare supplement program.
If you're on original traditional Medicare.
Yes, and that's only if you're on a traditional Medicare program. You cannot have a supplement plan if you have a Medicare Advantage plan. It will knock you out of one or the other, depending on which one you put in last.
And the Medicare savings program, which you were talking about
Right.
earlier with a yellow flyer, that can act as a supplement if you can't afford
Right.
the 20%. You can get that. You can't have both,
Correct.
but you can get the, it's called the QMB program, which
Mm-hmm.
acts as a supplement. Many people have it. They don't understand it. If you do have the Gray Connect card and you are on the QMB program and you don't understand it, you can call me and I can send you this flyer, because on the back I have examples
Mm-hmm.
of when you shouldn't be making payments or so forth
Right.
on it. And I specifically made this to educate beneficiaries to understand what this program, how it works. And I also made it for providers, because many providers improperly bill people. It used to be called balance billing. But you should not have a co-payment because you're on this program. By the way, people are confused. If a drug plan, if you have a separate standalone drug plan, you do have co-payments for your medications, but you don't have a co-payment for the Part B, for example. All right, so that's very important to remember. Again, please call us at 1-800-994-9422 or 203-757-5449. And is there anything you want to tell us about what you enjoy about being a volunteer the most?
I love talking to people and helping people figure out what's best for them and understand what choices they have with the Medicare program. And if I get to know a little bit about their situation, I might be able to help them make more informed choices. And we're not making the choices for you, you are. We don't get paid for actually having you select. We don't get paid for having you enroll per se. But you know, as opposed to if you call a private insurance company, they want to get you enrolled, and they provide commissions to the people that provide that support for that.
Yeah, and I usually tell people that I say, we don't steer you in any direction. We just give you your options, and then you decide. A lot of people will say, well, what do you think? And I said, I can't make that choice for you. I can just tell you. For example, on the Medigap supplemental plans, a lot of people pick more expensive plans because of the brand.
Correct.
You know, they pick it over brand. And I said, you know, all those plans are equal.
Right.
They all have to offer the same thing. And some can be like $100 difference a monthly payment.
Right. There are different plan types for the supplement plans. But a G type plan or an N type plan, if that's the one you have, all the G plans basically pay out the same. Medicare makes the decision, and that private insurance companies covers the other 20%.
And it's the same with a high deductible plan. For
Right.
example, you could be, the high deductibles are about $50 a month, and I think the deductible, you have to spend up to like $2,900
Yeah,
before they kick in.
Right.
But all those plans, the same thing, you know, they all are equal. But people have brand loyalty.
Sure. And that's, I mean, if you may have worked for that company, you may have friends that work for that company. Yeah, you make your own decisions. I mean, that's really, it's really your choice. Yeah. Even talking to your spouse might say, I really want this company. They say, okay, fine. We might spend more money, but that's okay.
And the same thing during open enrollment. That's the most important time to choose or to switch your drug plan, because every year your medications may change. So our volunteers will put all your medications. We usually ask you to fill out a form ahead of time, which has...
It has prescription drugs and what types of dosages you have. Whether it's a capsule or a tablet or a spray or whatever it might be. And then, you know, you take that, you also take your your preferred pharmacies. And then you look at, through Medicare.gov planning tools, you can compare plans. So you key in your prescriptions, you key in your preferred pharmacies, and then you do a search for whether you want it to be a Part D prescription drug plan or a Medicare Advantage plan.
And I tell people, I just want to say, it's very important to compare pharmacies.
Right.
Because depending on the drug plan, you could save hundreds of dollars depending on the pharmacy you go to.
Or your drug may not be covered.
Right.
And if you haven't gotten an exception with that plan, you might be paying retail price. So the one individual I was dealing with actually was spending, you know, thousands of dollars on a prescription because his plan didn't cover it in their formulary. But I was able to find a couple of other plans where it was covered. So he went down to a couple $100s versus thousands of dollars that he was spending.
I once had a woman, one drug was $800 at her favorite pharmacy, and she had like 10 other drugs which were all reasonable.
Sure.
And then 2 miles down the street, that same $800 drug was $100.
Right.
So I told her, because every drug plan has different contracts with different pharmacies. That's why you really have to do that comparison. So I said, get all your regular drugs at your favorite pharmacy and go 2 miles down the road and spend,
That's right.
you know, save a lot of money. But this is why it's so important to do that comparison. And then we send out, I think 3, right? The top 3.
Yeah, so yeah, the in the plan comparison, you can compare 3 specific companies. You actually get the full list.
You can do
but then you
6,
select
yeah.
3 of them that you want to see side by side. So it'll do a summary level of what's the total prescription drug costs and the premium costs for the full balance of the year. So the plan comparison will provide that for you, so you can look at the cost side of it, but you could also look at what's the cost by pharmacy. So your preferred pharmacy versus mail order or another pharmacy.
And I usually tell people that on those drugs or whatever, it doesn't really, depending what medication you take or whatever, on that comparison, I've had certain people say, oh, they would save $5. And they say, I'll stick with my same company.
Sure.
You know, it's not that big a deal for them, and that company had worked fine for them. But sometimes people just aren't happy with their company. They feel the customer service is horrible.
Correct. Yeah.
So they'll want to change. So we give that option. So,
Absolutely.
all right, I'm going to call out our number one more time. If you'd like to volunteer for us, or you have any question about Medicare, please call 1-800-994-9422 or 203-757-5449. And Gene, do you have anything you want to say and final about being a volunteer at our agency?
Well, you have to choose what's best for you in terms of volunteering and how do you want to use your time and contribute in terms of your give back. I actually like this one for myself because it allows me to use my brain, keep that active, so maybe I don't deteriorate as quickly. But it leverages my skills from when I was employed, and it allows me to meet a lot of people and help them with their situation. So I love it. Yeah.
And we also have a system. I mean, you don't have to come into the Waterbury office. You
Yeah.
can work at your local senior center if you want, and be a choices counselor. And we have people who will mentor you and work through any problems that you may have. So I think that'll be the end of it. And
Yeah.
thank you very much, Gene, for taking your time and coming all the way up from Ridgefield.
No problem.
Very nice of you.
Thanks, Audrey.
Thank you all.
Take care.